is Dr. Doyin Ogunyemi, a public health physician. She joins us virtually. Thank you for joining us on the program.
Thank you for having me.
All right. I'd like to begin. I mean, are you in agreement the sum of 6,000 naira for COVID-19 vaccines for private healthcare facilities?
Well, let's start with why private sector involvement. We're told private sector involvement so that people who ordinarily would not go to the public health facility can get the vaccine. So it's called an administrative charge. But again, when we look at vaccine equity, we're actually talking about fair access, just access to all. So this administrative charge and the use of private facility, while it has its own advantages because you're allowing access to more people, but the real question then is what sector of more people is most likely going to be the elites that would have that access. Though it allows private sector to also strengthen its capacity, there's the advantage that they would also learn other things around the vaccine and be able to provide service. However, I don't see the balance in the sense that the other socioeconomic class, the lower class, is unlikely to want to pay that amount to get the vaccine. So what are we doing in trying to get more people vaccinated, 4 million people vaccinated? What are we doing to get that set of people? Can we also look at other incentives that can encourage such people to come on board? So the other fear I see is that private sector seems to have better efficiency, maybe lower waiting times. And I worry that we do not have a scarcity for one reason or the other. The state government has said that this is in addition to what will be happening in the public facilities. But we remember how testing went when it went most private. It became a very expensive and unreachable sort of, and that is what we must avoid at all costs. Those in the public facilities, the health workers, they already have their own duties apart from the COVID work they're doing. So there must be additional staff and everything they require to ensure that they meet up so that we do not have a case of inequity and access to only those that can afford it. As regards the cost, I don't know what was added together to get that cost. I would think that is a bit on the high side, considering that it came completely free. However, I'm more concerned in ensuring other incentives, like giving people 3 days to be able to get the vaccine, or getting some palliatives, whatever that is, for coming to get the vaccine. That will be more attractive to lower income socioeconomic group, and they would likely want to get it. More importantly is confidence, in building the trust of people in getting the vaccine, and that's what we should continue to do. Let's also not forget the non-pharmacological interventions, which remain important, because the vaccines as we have to achieve herd immunity is still a long way to go. We continue to give it, but at the same time, we must remember the non-pharmacological interventions to ensure that people don't come down with the disease. Yeah.
And there's also the angle of vaccine hesitancy. I mean, there is still a fair amount of people who are hesitant to take the vaccine. And then, you have this price tag for private facilities. I want us to talk about the mass vaccination efforts of the state government. The governor was saying to sort of put an end to the third wave and avert a fourth wave, the mass vaccination drive, and that is vaccinating 4 million people before December 25. I mean, do you think this is practicable?
Well, I mean, we've been able to, more or less kick out polio by doing a lot of mass vaccination activities. And so if we really do mean business, we can do it. But I'm not sure that this approach of payment in private facilities is enough to achieve it. Like I've said, it seems one-sided, the group of people that would target. So if we must achieve it, we must look at other ways. Do we want to, because there are a lot of people that are just undecided. Yeah, we have those that are hesitant, but they are not refusing. They just need a little more information, a little more attraction, and then they will get the vaccine. So the styles we have used in other vaccines should also be employed, including mobile vaccination sites, including giving of even financial incentives, if need be, albeit minimal, to just ensure that more people come for the vaccine. But we can achieve it with the number of facilities that we have, both public, private, and all the facilities. It is achievable.
Let's look at the cases that we're also seeing, the case numbers. Are you confident that the state government's efforts are indeed, reducing and fighting the virus? Because if you look at the numbers, I mean, today it was, Lagos wasn't top, but several other states have been recording cases and reporting numbers. Do you think that we are succeeding in fighting the third wave?
Well, at the moment, even with the cases, it has dropped when we compare it to the peak of it. So I think that we don't even expect so many cases at this time. The next time we expect a lot of cases is probably in December, and hence the rush to get people more vaccinated. Again, I still see that with a lot of gatherings and meetings, we're begin to put down our guards in terms of using our face mask and the other things. And the vaccine does not prevent people completely from getting the virus. It only prevents, severe diseases. So we must go back to those things and continue to talk about use of face mask, wash your hands, apart from getting vaccination, and of course to continue to encourage people to get vaccinated. So we should keep our eyes on the number, and particularly for the fourth wave that is being predicted, and do everything. We have only about 550,000 in Lagos that have had 2 shots, so going to 4 million is quite a number. But Lagosians, there are many, and they're in different areas, different parts, and so we need to be multi-strategic in ensuring that we reach all of those areas and everybody that is eligible to be vaccinated.
We appreciate your time on the program. Dr. Doyin Guyeme is a public health physician. Many thanks for joining us today.
Thank you for having me.